Welcome back to the MI Mental podcast, the Doctors in Court edition. In today's podcast, I'm going to explore a complex and controversial case involving a psychiatrist who I'll call Dr. Evans and her long-term patient, Miss Lee. This case highlights the ethical challenges of maintaining professional boundaries in psychiatry and what happens when those boundaries blur. It's a story of good intentions, difficult decisions, and the fallout when lines between professional care and personal connection become indistinct. Whether you're a mental health professional, a patient, or someone interested in ethical dilemmas, this episode has something for you. Let me dive into the details. The patient-doctor relationship between Dr. Evans and Miss Lee began in 1994, after several psychiatric hospitalizations left Miss Lee seeking outpatient care. For over 13 years, Dr. Evans provided weekly therapy sessions, managing Miss Lee's severe dissociation, frequent suicidal ideations, and occasional substance misuse. Their relationship went beyond the usual therapeutic norms. Dr. Evans would email Miss Lee from her vacation, send her postcards, and even give her gifts like scarves and a ring. On the other side, Miss Lee frequently brought Dr. Evans flowers and other tokens of appreciation. These actions blurred the lines between therapist and friend. Things escalated in 2005 when Miss Lee had an emotional crisis after Dr. Evans refused to schedule an extra appointment outside their regular sessions. The next morning, Miss Lee was found disoriented and undercooled on the roadside, requiring neurological evaluation. Though no physical injuries were found, this event deepened the complexity of their relationship. In 2007, Dr. Evans decided to end the relationship with Miss Lee, citing feelings of personal unease after a session at Miss Lee's home where she felt physically prevented from leaving. Dr. Evans proposed 4 transitional sessions, but Miss Lee refused and later filed a formal complaint. Miss Lee's allegations were really extensive. She accused Dr. Evans of many things, including failing to provide adequate care, misdiagnosing her condition, overprescribing medications, failing to refer her for additional treatment, blurring boundaries through the exchange of gifts, failing to inform her GP about her treatment progress. Dr. Evans defended her actions, acknowledging that some aspects of the relationship could have been handled differently, but maintained that her care was within professional standards. She stated that all actions were motivated by the best interest of her patient. The court concluded that while some aspects of the relationship were unconventional, Dr. Evans had acted within the boundaries of professional care. They acknowledged her attempts to maintain boundaries even in challenging circumstances and emphasized the difficulty of working with a highly dependent patient. However, the court noted that certain actions, like exchanging gifts and the prolonged personal communication, created unnecessary vulnerabilities in the therapeutic relationship. They stressed that clearer boundaries could have prevented much of the tension that had led to the complaint. Ultimately, the court dismissed all allegations, finding that Dr. Evans' care was consistent with the standards of the time. However, the case served as a cautionary tale about the importance of maintaining professional distance even in long-term therapeutic relationships. Here are some thought-provoking questions. First question for you. How do you maintain empathy and connection in a therapeutic relationship while ensuring clear professional boundaries? And when does connection cross the line into over-involvement? Well, maintaining empathy requires regular self-reflection and supervision, and therapists should use clinical supervision to discuss boundary challenges and seek advice on maintaining the focus of the therapeutic relationship. And small acts of connection like kind words or reassurance are appropriate, but giving gifts and personal favors risk complicating the dynamic. The second question, should long-term therapeutic relationships have built-in mechanisms for review or external oversight to prevent dependency and ethical challenges? And how should such mechanism work in practice? Sure, long-term relationships can benefit from periodic reviews, either through formal supervision or peer consultation. This can provide fresh perspectives and identify areas where boundaries might be blurring. Regularly reassessing treatment goals with the patient can also ensure the relationship remains therapeutic and not personal. A while ago, we had a patient who was requesting a referral to a specialist. The patient lived in another country and she decided that she wanted to come back to her country where I was practicing and get referred to a specialist there. Now, obviously, you can imagine that it was problematic in terms of the distance, but the staff and I talked about it and we said, yes, of course, she can be referred. We processed the referral, but the patient was not very happy. So there was a lot of back and forth emails. And one of the things I did during those email exchanges is that I always made sure that I included my staff members. So everybody in the team was aware of what was going on. At a certain point, the patient wanted to be referred, but then it should have been an emergency referral. So she wanted us to switch that original referral and make it an urgent one because she was going to travel to that country where she was going to see the specialist. And in the period that she was there, that would be the time that she could go and see the specialist. Now, I tried to explain to her that that's not how things work. My assistant tried to explain to her that that's not how things work. And the patient became extremely upset. And the only way to calm her was to invite her to the clinic so that we can discuss it face to face. Again, doing things like that helps set boundaries. And we make sure that we tell all the patients that we treat them the same way, and there are certain protocols that we will follow. So this is just a small example that in practice, it's not uncommon for patients to seek favors, to seek something that they feel is an emotional importance. And that's one of the things I said to her. I said, I understand that for her, there's an emotional urgency because she's been suffering with this condition for many years. And then I told her, I will contact the specialist and tell them this is the case, this is what's going on. Do they see a need for it to be scaled up to an urgent referral? And the same day I contacted the specialist, and in the same day the patient was told that there was no reason for it to be scaled up to an urgent referral. And since then, we haven't heard from the patient. This case highlights how even well-intentioned actions can lead to misunderstandings and complaints. And the key takeaway for mental health professionals is to balance compassion with clear boundaries to protect both the patient and the process of therapy. And for patients, it's important to recognize the role of boundaries in ensuring effective care. When those boundaries feel unclear, open dialogue can help reset expectations. Before I wrap up today's episode on blurred boundaries in psychiatric care, I want to take a moment to dive into something really important, managing complex cases like Ms. Lee's. It's one thing to talk about maintaining boundaries, but let's not forget the challenges of treating patients who don't respond to traditional therapy models. I came across an interesting study in psychological medicine by Rush and colleagues, and that focuses on something called difficult to treat depression, or DTD. It's a term that resonates so much with what we've discussed today, and patients who don't respond to multiple treatments and whose recovery is often complicated by deep psychological struggles. And what stood out to me was how common DTD is. About 1/3 of people with major depressive disorder fall into this category. And think about that. So for every 3 patients I see with depression, 1 might face chronic symptoms that don't improve with the usual approaches. The study talks about shifting the goal from just remission of symptoms to improving quality of life and functioning. And that's where things might have gone sideways for Dr. Evans. Maybe she got too emotionally involved because she saw how much Ms. Lee's struggles went beyond depression. They were about survival in a really tough life situation. And this is a slippery road. The study emphasizes a team approach, integrating psychotherapy, medication, and even newer techniques like neurostimulation when appropriate. And that takes the pressure off one person to fix everything. It's also a reminder to use supervision effectively. Having someone else to discuss the emotional weight of cases like this can really help you step back and think, okay, how do I stay empathetic without overstepping professional boundaries? And for patients like Ms. Lee, it's about reinforcing that boundaries are there to keep care focused and effective. And that's a tough conversation, but it's necessary for long-term trust and progress. For mental health professionals, if you're working with a patient who seems stuck in their recovery, it's okay to admit you don't have all the answers. Reach out for peer consultation or supervision, and always look for holistic approaches, integrating therapy, medication, and lifestyle changes. And for patients and families, remember, therapy is a partnership. If things aren't working, don't be afraid to ask about other options or bring up concerns about boundaries. A healthy therapeutic relationship is a key to success. This was a heavy episode, but really important discussion. The challenges of treating difficult to treat depression are real, and they remind us all, whether we providers or patients, that boundaries, communication, and teamwork are what keep therapy effective. And thanks for joining me again on the MI Mental Podcast, Doctors in Court edition. Next time, I'll dive into another case that pushes the boundaries of medicine and ethics. And don't forget to subscribe and share your thoughts on today's episode. And see you soon. Thank you.